So we talked a little bit last week about diet and drugs associated with diabetes. Now let's talk a little bit about the damage that it can really do on somebody's body. It affects all parts of the body.
It
Correct?
absolutely does, yeah. So if you recall, what we were talking about is the high blood sugar in your bloodstream will cause inflammation and eventual plugging of the arteries that lead to all the major organs, from your vision to your brain to your heart, to your kidneys, your skin even. And the fact that you're not getting good blood supply and that there's a lot of inflammation results in all these complications.
Okay, so when we talk about some of the damage, let's talk about what it can do to a person's skin.
Okay, sure. Well, I think the most common thing I see is infections, and I think the really commonest is fungal infections. So yeast infections, Jaff, ringworm. I sometimes see people have ringworm for 7-8 years, you know,
Oh my
very,
gosh.
very long time with this problem. Or vaginal yeast infections for women. And this is because they're perspiring on our hot tropical island. Their skin is sweet, and fungus loves them, and it proliferates, and they get these horrible rashes. Another very common one would be bacterial infections, especially boils and sores. Small little cuts, things like insect bites even in a diabetic can result in just a horrible wound down the road, because again their skin is sweet, their bloodstream is sweet, and that is food for bacteria. So they will tend to have much more severe infections. And the worst is on their feet, you know, either between the toes as far as like an athlete's foot kind of thing, or frank ulcers and sores on their feet and ankles.
Wow.
Yeah.
Okay. So there also diabetes can affect the eyes, and I know you were mentioning last week a little bit about how you were saying the sticky substance kind of closes off, so someone can actually lose their vision. But I think glaucoma and other things, other vision problems are associated with diabetes.
That's right, yeah. Well, diabetes is an inflammatory disease. There's a lot of inflammation in the whole body. But as far as the vision, basically, you know, if you see an eye specialist, they can look in the back of your eye. If you're diabetic, you're supposed to do that once a year. To have an eye specialist, an optometrist at least, or ophthalmologist, look in the back of your eye at the retina and see what's going on there. And they can see whether there's little plugging of the blood vessels in the back of the eye. They can see whether there's mini tiny little baby strokes back there, or and other problems with the retina that diabetics get, that over time result in their having like a very patchy vision. Instead of having a nice clear field of vision, they'll have sort of holes in their vision, and over time go blind. And it's the #2 cause of blindness in North America, being diabetic. So a totally preventable problem, because if you are a diabetic and you know how you're doing on your blood sugars, you're trying to bring those down to a good level, but you can go see the eye specialist once a year, and they can actually laser the back of your eye and help you with those blood vessels that are overgrowing, causing problems back there, and damaging your vision. So they can actually correct the problem before it gets really bad.
Okay, good to know. Now, also, diabetes can have very damaging effects on different organs. Can you talk a little bit about that?
Sure. Well, the major ones are heart and stroke. Diabetes is a huge risk factor for both of those, again, because of inflammation in the blood vessels and eventually getting poor blood supply and resulting in damage. But the other damage is done to kidneys, dialysis we talked a little bit about last week, kidney failure. And then, you know, the other organs would be, you know, your limbs. And people feel numbness and tingling in their fingertips and toes when they're diabetics. We call it a glove and stocking distribution, meaning like they'll start at the fingertips. Oh, I just feel a little bit of tingling. And then pretty soon it's up to the middle of the fingers, and then it's up the whole hand. And for the feet, it'll be all the way up to, you know, the middle of their leg. And that numbness and tingling is really uncomfortable for them. And it's again from poor circulation and inflammation of the nerves that go down to the legs and the fingertips. And that's a later complication, again, of diabetes. And if you don't feel things very well, you'll get injured more easily. You'll get infections because you don't even know that you've got a sore.
Wow. So and you also mentioned some of the complications. You were talking about heart disease and stroke. And I think high blood pressure and hypertension are also another complication as well.
They're actually not. Many people think that, but they're actually a separate risk factor. See, so you have diabetes, that's one risk factor for heart and stroke. Then you have high blood pressure and high cholesterol. But they all get lumped together. Why? Because they're all a result of obesity in many people. So the bottom line is the overweight problem. From there you get diabetes and the cholesterol and the high blood pressure and even gout, and we've talked about some other things like that.
Okay, and so before we throw it to the break, just anything else that you'd like to mention with regard to the diabetes, the damage that it really causes to all parts of your body? I know after the break we'll get to specifics like foot complications and things like that, but anything else?
Just that they're preventable. And so sometimes people feel like, oh, I'm doomed, you know, my whole family has diabetes and they're on dialysis. I guess that's what's going to happen to me too. It doesn't have to be that way. And it's just a matter of what you're putting in your mouth and how quickly you're moving your body. For most people, if you're overweight, if you're eating the wrong foods, you've just got to take a look at yourself and change what you're doing, because no one can do it for you. The pills will help, the insulin will help, but really the one that needs to do the work is you. And so, you know, we talked a little bit about diet. Just cut your plate in half, eat only half of what's on your plate, focus on vegetables, fish. That is what the local population over centuries used to eat, you know, until the modern age when convenience foods and canned foods and so on came along.
Fried food, processed foods, right, came into play. Well, we've got to take a quick time out, but we'll pick up our discussion on complications of diabetes when healthy living returns. Stay with us.